So welcome everyone. For those of you who do not know me, my name is Krista Ellis. I'm the Community Programs Manager with the Parkinson's Foundation. I reside in Tampa, Florida, and I'm here to practice meditation, mindful meditation with you, your person living with Parkinson's disease, and anyone else who has joined our wonderful community here. For today, we're practicing with the lovely Dr. Taylor Rush from Cleveland Clinic. She's got a really interesting topic for us to explore today, so make sure you stick around for the entire session. If you're just joining, just note that you will be on mute for the duration of today's session. It just allows us to relieve as many distractions as we can because the mind itself is just so distracting that outside sounds or other things other than what we're trying to focus our attention on are cut out. Feel open to submit questions, comments by using the chat function. We're very chatty in the chat function, so please don't hesitate to write something in the chat. Let us know where you're tuning from, how your day is going. If you're living with Parkinson's, a care partner, whatever you feel like sharing, don't hesitate to share it. And I'm an avid advocate for seeing your face on screen. So if you are able to join us on video and are comfortable with joining us on video, please do feel like you have the permission to show your face in this mindful Parkinson's community. Our next live English session will be October 18th. We'll be practicing physical well-being. Before we move on, I'd like to ask you guys a question. So I wanted to thank each of you who submitted feedback on our survey in the recent weeks and months. I've retained a lot of information from each of you who shared comments, responded to the questions. So I really appreciate you sharing that input with me. So today I'm going to ask you guys what kind of topics that you would like to explore in the future. So I have been tasked to plan our sessions for 2022. And I'm going to launch a poll here for you guys to answer. So there's tons of topics behind meditation, right? And we focused on quite a few, but the ones that are appearing on screen are the more common general topics of meditation. So we've got gratitude, breath work, pranayama, so breathing, loving kindness, mindful movement, stress relief, acceptance, and some other topic that might be of interest to you. So let me know by answering the poll. Here's a kicker. You can have one or more, you can have two and more options. So if you see three up there that you want to practice more of, choose three. You don't have to choose just one. If you do choose other, please write it in the chat. We do save the chat and I'm able to go back when we end our session together and just review those comments. And so we got about 50% of you have submitted your answers. And right now, stress relief is winning. Good. 65% have answered. We'll give it about 20 more seconds. So if you're just joining us, you can choose multiple topics of interest for our future sessions together. 5, 4, 3, 2, 1. Good, we got more, about 3/4 of people participated. Thank you guys so much for that feedback. With the winning result is stress relief. Funny thing is, each topic we practice has an element of stress relief. So thank you all for sharing that feedback with me today. Keep in mind that after our next live session, we will have our Spanish session on October 25th. So be sure to tune into our YouTube channel to go back to a session of interest for you to practice. So staying within your practice during the time that you've committed on October 25th. And make sure you tune into this Wellness Wednesday's topic for social engagement poetry for Parkinson's disease. We've all heard of Shakespeare, but how can this renowned poet, playwright, and actor play a role in Parkinson's disease today? Learn new ways to use Shakespeare's poetry and plays to warm up your body, increase breath capacity, strengthen your voice, improve speech agility, and enjoy the magic of his writing. So that's Wednesday. You can sign up at parkinson.org/pbhealth. A little bit of mission about the Parkinson's Foundation. I want to be sure that the mission of the foundation, for those of you who are just joining us today, is shared with you. Every day and in everything we do, the Parkinson's Foundation staff and volunteers are working to make life better for people with Parkinson's disease. We fulfill and achieve our mission by pursuing 3 goals: improving care for everyone with Parkinson's, advancing research toward a cure, and empowering and educating our global community. We're doing that right now in this very moment by gathering in our Mindful Parkinson's community. If you have any questions during your Parkinson's journey or your loved one living with Parkinson's, please do not hesitate to review all of the content on our website or reach out to our bilingual helpline at 1-800-4PD-INFO. Now I've taken enough of our time. Let's dive into our mindful discussion today and into our meditation. Dr. Rush, the mic is yours.
Thank you, Krista. All right, so many buttons that come up with Zoom sometimes. Okay. Hi, everyone. It's so lovely to see you all today. I have to say this is one of the highlights of my month, really, is being able to come on here and chatting with you guys and sharing a little bit about mindfulness and, how to make this practice your own. So I was thinking about today's topic and kind of what I wanted to do. And I thought that maybe we would spend some time discussing mindful awareness of mental activity during meditation. So when I first start working with people and we're building a meditation practice for them, something that I will often hear, especially as people are starting to get this established, is that they get very distracted by random thoughts that may run through their mind as they're trying to do their meditation. And they often express frustration or judgment of having thoughts during their practice. And it kind of can take them down a bit of a rabbit hole. And so they're like, gosh, I can't stop thinking. My brain just keeps going. There are all these random thoughts that just pop into my head. I must be doing something wrong, or I must not be trying hard enough, or, maybe this just isn't for me. And so when I hear people say that, I often will actually tell them a story related to my own meditation journey. So when I first started out, I was kind of a skeptic of meditation, to be honest, and I kind of got roped into it in my graduate school program because I worked in a stress and health laboratory. And so I ended up taking a mindfulness course through Duke University. And as part of that course, we did a whole day-long meditation where we barely talked and had to basically meditate for 8 hours. And at the end of this, there was a question and answer session with the instructors and reflection of the day and what questions did we have about our practice and enhancing it. And one woman asked, probably the most senior meditator there, who ran the program and had been doing meditation for quite a while. She said, I still struggle with these random thoughts that just keep popping into my head. When can I expect that to stop? And he kind of looked at her with this wise grin. And he said, I've been practicing the mindfulness for almost 40 years. And I will let you know when that day comes that I stop having random thoughts. And it kind of was such a relief to me because the same thing would happen to me. And so when I relay this story to my patients that I work with, I tell them, this just means that your brain is alive and working. It doesn't mean that there's anything wrong with what you're doing. It doesn't mean that you're bad at meditation. It just means that you have a living brain. And I'd be more concerned the day that some of those random thoughts stop. So what we end up doing, instead of trying to make our minds a blank slate or to not have random thoughts pop in, it's more a matter of how do we manage them? because the goal is really not to get rid of them, to say, okay, I need to stop thinking when I meditate. It's kind of like me saying, whatever you do not think about pink elephants. Where's our brain going to go? And so instead, we take a slightly different approach. We want to take note of those random thoughts that may come up and then redirect back to whatever the focus point is. So as you know, sometimes that focus point is the breath. Sometimes it may be a body scan or sensations within ourselves. There may be another point of focus depending on the topic of meditation. But the idea is that we understand that those thoughts exist, we acknowledge them, and then redirect. And so sometimes what you'll hear meditation instructors say is to, imagine the thoughts that come into your mind as leaves on a stream, and they're just kind of, gently floating past you, and they keep going, but you stay focused on where you are. Or clouds in the sky that, the clouds will come and go, they'll shift, you take notice of them, but then you don't follow them. And so I really like those ideas of, how to think of one's thoughts as they're meditating. But I have to say, I use a slightly different image in my mind. And I see my thoughts as squirrels on a tree, because my thoughts are not terribly, placid, riding along a river or floating through a sky. They're kind of darting all over the place, So the squirrel is, running up one branch and hopping over to another, and then running down and circling around the tree and going back and forth in the other. That's kind of how I see my thoughts when, I'm trying to meditate. And the squirrels have slowed down a little over the years, but they're still there. And so what I try to imagine is that I'm trying to focus on the tree and not the squirrels. So the tree is whatever the focus of the meditation is, my breath, body scan, whatever it may be. And the squirrels kind of come and go, inside my awareness, but I don't chase them up and down the branches and around the trunk. I just notice them and then let them keep going. And so we can sometimes acknowledge them and then release them more effectively if we label some of that mental activity before we let them go. So if you're noticing those thoughts just popping into your head, gosh, what am I going to make for dinner tonight? Or, oh, I got to remember to call so-and-so, whatever the thoughts may be, just kind of label them for what they are. So it might be a planning thought, like, what am I going to make for dinner tonight? So just notice that you have the thought and say, okay, planning. But now let's redirect back to the breath. Or it might be, gosh, am I doing meditation right? I don't think I'm doing it right. I don't think this is ever something I'm going to get a hold of, really. I bet other people are better at this than I am. Maybe saying, judging, and then redirecting back to the breath. And sometimes, even if we're not quite sure what label to put on it, we can just say thinking. The same can be true if we notice other mental activities. So like physical sensations, people may notice discomfort, or they may notice an itch on the edge of their nose that they just really feel like they need to scratch. And so, just labeling it for what you feel. And that goes for emotions too. So it could be that you might be feeling antsy sitting in one position for so long. So you might say, okay, noticing impatience. We're noticing frustration, and then redirecting. Or you might hear something around you. It might be a car horn or, fire truck or an air conditioner. And so again, just noticing what that is, labeling the noise, and then redirecting back to the breath. And so that kind of helps us to bring about that third-party observership that we want to see with meditation, right? It's about trying to observe your experience for what it is in as neutral a form as possible, because the more judgy we get, the more reactive we get, the more frustrated we get, the more meditation ends up kind of producing a counter response. And one thing that I will always tell people when they're labeling their thoughts, we don't want it to be, oh gosh, stop the judging thoughts. You're so judgy. Why are you being so judgy? And so it's kind of that critical judginess on top of the judginess. And so I will often say, try to come at it with a friendly and compassionate voice. So just noticing those thoughts without getting wrapped up in the fact that you're noticing them. Because often that kind of keeps you stuck in the thought and you go down a whole other rabbit hole. So just trying to notice it with kindness, gentleness, and then redirecting back to the point of focus. So kind of to summarize that, so thoughts are normal. You're going to have them as long as you have a brain that resides in your head and it's alive. It's okay to have intrusive thoughts that come up in the midst of meditation. It's okay. We just want to then acknowledge them, label them, let them go, and redirect. So I thought maybe we could spend a few minutes in meditation with one another where we practice this in a gentle, benevolent way, okay? So let's go ahead and get comfy in our chairs in whatever position you might be in, seated, reclined, laying down, whatever it may be, just as comfy as you can get. Allowing your shoulders to rest down, allowing your spine to be supported. Allowing your sit bones to settle in your chair, couch, wherever you may be. Giving yourself permission to be here right now. Maybe even exercising some proactive compassion for the thoughts and other sensations that will inevitably interrupt this meditation. So we'll keep this simple today with just an intention to set focus on the breath. Noticing your breath where you may feel it most: nose, mouth, throat, lungs. Not trying to change the breath in any way, but just notice its natural rhythm, cadence. Recognizing what your body does 24 hours a day to keep you nourished. And if you haven't already had a wandering thought or sensation, take notice of any that may arise. Allow yourself to gently notice the thought without admonishment or judgment. And consider putting a descriptive neutral label on that thought. It can be as simple as thinking or feeling. Whatever that thought may be, allow yourself to come back to focus on the breath. And for each thought that comes into your mind, gently notice. Label. Let go. And redirect back to the breath. Remember that it's not how many times your mind wanders that matters. It's how many times you can bring the focus back to where you want it. In this case, the breath. As you continue this process of labeling your thoughts, sometimes you are able to get more specific. You may label a thought as a worrying thought, a remembering thought, a wanting thought, a comparison thought. Or you may notice certain emotions. You may be able to label them. This is frustration, or this is peace. This is sadness. And may even notice any physical sensations that go along with the emotion. Such as tension or heaviness. Again, with each thought, label, let it go, redirect. This exercise actually serves to strengthen mental muscles you probably didn't even know you had. Remembering to keep a gentle, compassionate tone as you label the thoughts that arise. Not trying to stop them. No admonishment. Just acknowledgement. And then letting it go. Through practices like these, we are able to recognize the power we have over our thoughts, the ability we have to dismiss ones that are not helpful, and the ability to pay attention to the things that are important, such as the anchoring power of the breath. Let's take one nice deep breath here before we come back to a more active awareness. shifting those shoulders, wiggling your toes, your fingers. And opening your eyes when you feel ready. All right, I'm starting to see some eyes. So if anyone has thoughts about this practice that we just had, questions, happy to chat with you about those in our remaining minutes. And as those may be coming in, I know that sometimes this can be a challenging thing because we think, okay, I'm just focus on the breath and try to push the other thoughts out. And sometimes, the idea of entertaining the thoughts a little bit by kind of actively labeling them seems odd or uncomfortable or difficult. And so know that that's normal, that's part of the process. And also know that, for some people, the breath ends up being a very anchoring experience, and that kind of really helps them. But if there are other things that make it, that would be a better anchoring experience for you. So for some people, it's different sensations within the body, like the groundedness of the feet, or a specific environmental focus. And so it could be, listening to a certain sound in the environment, or trying to ground in a certain smell that they may be experiencing, but they have other focuses that help them to anchor. If there are other things than the breath that would be helpful, by all means, insert something else in that anchoring behavior. So just a point of that. And, I know sometimes there are certain thoughts that may seem really hard to let go of. And again, that's normal part of this process, is that sometimes those thoughts kind of feel like they get stuck. And what can we do in order to get unstuck from those thoughts? And sometimes we have to kind of look at what may be underlying those thoughts and what the roots are to it. Maybe there's some powerful emotions or experiences that are going along with those thoughts that we may not always address in everyday life, that tend to make an inopportune guest appearance during meditation. And so sometimes it may be something our brain is trying to tell us, and that's the only time it's quiet enough to hear it. So let's see here. So I like Joan's idea of just trying to ignore the breath and let it be natural. Focusing on breath seems to guide it. So again, for everyone, it's a little bit different. And so maybe even taking that pressure off of thinking about the breath or trying to focus on it, and instead just allowing yourself to be. For some people, they're able to do that comfortably. And if so, by all means, you can certainly try that.
Well, thank you, Dr. Rush. And I'll just reiterate, meditation isn't for the flexible, it is for the willing. And it's not meant to be an easy practice, because if it was, everyone would be doing it. So for those of you who may have found this a little bit more challenging, or if it's your first time, first of all, major Applause to you for continuing to try, and applause to those who maybe tried something new today. It is a practice, just like anything. If you want to get very good at it, you got to do it quite often. I'm still really terrible at meditating, but I still do it. I have my challenges too, just like each of you may experience through our time together each Monday. So continue to show up for yourself, for your mind, and for your body. If I did get a couple of direct messages from people who are newly diagnosed with Parkinson's disease, or if this is your first time meditating, I just wanted to be sure to share that the foundation is here for you in your embrace for Parkinson's disease or your loved ones newly diagnosed. So please don't hesitate to reach out to the Parkinson's Foundation by helpline at 1-800, the number 4-PD-INFO, 1-800-4PD-INFO. Browse our webpage at parkinson.org for content, material, educational programs. Find a movement disorder specialist near you, a neuropsychologist like Dr. Taylor Rush near you, and continue to show up for yourself. Continue practicing the things that may be challenging, as well as the things that might find some ease for you. So thanks for being here today and for all your feedback, and Dr. Rush for your guidance this morning, this afternoon.
Thank you. Thank you all for inviting me. Have a wonderful rest of your day.
We'll see you guys next Monday.